ivermectin fenbendazole cancer protocol with oxygen therapy for this patient. We've had good success with this protocol. And let's take a look at some of the findings before we get into what we have been doing. She has had interval change decrease of previously seen left upper lobe pulmonary nodule measuring 3 millimeters, previously 5 millimeters. Interval size decrease of left lower lobe nodule measuring 2 millimeters, previously 4 millimeters. Let's see. Lymph nodes, interval size decrease of previously seen dominant left supraclavicular adenopathy measuring 1.5 centimeters, previously 2.3 centimeters. And so that's very cool here. So what has this patient been doing? Well, mind you, we've had success with this in the past for this patient where we did see this shrinkage before. This was with chemotherapy and a lot of alternative treatments as well. However, she went through a rough patch and started eating more cakes and sugars, and the cancers came back. Now, she's changed the diet up completely. She's doing ketogenic, and she's doing fasting. So she'll do prolonged fasting, mimicking diet, 5-day fasts or 3-day fasts of water, and she is cutting out completely all sugar. She's drinking no milk, and she's doing fantastic. We're seeing all these fantastic changes. Mind you, she's also doing folfox chemotherapy, right? But no radiation as of yet. In addition, what she's doing is she's doing exercise with oxygen therapy. So she's doing breathing through an oxygen concentrator, 96% pure oxygen on the bicycle. She's rowing, she's on the rowing machine. She's doing vibration plate, resistance band training. She's doing rebounder, so all these things that move the lymphatic system. She's also doing hyperbaric oxygen therapy on occasion, especially when she's, after having done chemo, she feels a little bit down. So she'll go and do hyperbaric for a couple days. And she's also noticed, interesting, that her skin looks a lot better, and people are commenting that her skin looks fantastic. They're like, wow, chemotherapy is good for you. Like, no, it's not chemotherapy. It's like everything else that I'm doing as well. In addition, she is using our protocol, ivermectin and fenbendazole, and she had been taking it every day. And now, since she's doing so well, we're backing off this to maybe twice a week, ivermectin and fenbendazole. She's going to continue the diet, ketogenic diet. She's going to continue doing fasting on occasion, and she's going to continue doing all this other training that we've been doing. She's also doing sauna. She's doing cold plunging, all these additional complementary things. And the interventional radiologist wants to do radiation therapy as well. And I was like, well, why do they want to do this? Well, it's because in conventional medicine, they only have the radiation, they have the chemo, they have the surgery. That's all they have. That's the evidence-based. That's what they're going to do. And the surgeon and the interventional radiologist is correctly worried that it will come back. As we saw before, it did come back. But why did it come back? It came back because of lifestyle, right? She started eating the cupcakes, the cakes, the sugars. She didn't exercise. She was depressed, and the cancer came back. I told this patient, look, you're going to live with this for the rest of your life. It's always going to be there. You have to maintain these daily things that you're doing. Yeah, the low-dose naltrexone you're taking is a good anti-cancer, ivermectin, fenbendazole. The most important modifier of this disease is the metabolic. You have to improve your metabolic dysfunction, and that's through the diet, that's through the exercise, all these things. And so the patient decides she's not going to do radiation therapy. She's just going to continue on this protocol that she's doing and maybe get another MRI in a couple months to see if maybe there's further shrinkage of these masses and the lymph nodes. If there's recurrence, well, maybe she has to do radiation and chemo again at some point. But right now, she plans on maintaining the course of therapy. So that's what we're going to do here. And she's also going to see some fantastic body weight changes. I mean, she's going to get thinner because she's a little bit heavier set right now. But as she continues this, she's going to see those. I told her to take before and after pictures because she keeps training like this and eating well. She's going to see some fantastic changes.